Hello and welcome to this exclusive fireside chat on transformational journey and future roadmap of development in the state of Meghalaya as part of ET government second DigiTech Conclave. To lead the discussion, I am joined by a young, visionary and enthusiastic leader, Mr. Conrad Sangma, Honorable Chief Minister of Meghalaya. Thank you, Mr. Sangma, for joining us and giving your valuable time.
Thank you. Thank you very much, Arpit.
Let's begin the conversation. My first question to you, Mr. Sangma, is Meghalaya has a population of approx 39 lakh people, of which over 74%, that is 29 lakhs, are under the age of 35 years. Recently, the Cabinet of Meghalaya has approved the Meghalaya Youth Policy 2021. How will it create pathways for Meghalaya's youth in becoming engaged, skilled, creative, responsible, and empowered locally and globally? Can you please talk about some steps and figures of jobs and employment provided to the youth and unemployed masses?
So, Arpit, as you've mentioned, that we have come out with the youth policy. And as a government, we believe that this is one of the most important policies for the state. It's not just the state of Meghalaya, but the entire country today has got this huge potential with the energy of the youth. We believe that if this energy of the youth is channelized in the right way, it could be constructive. And if it is not channelized in the right way, it could be destructive. So therefore, the youth policy will ensure that we channelize the youth energy into the constructive work to build our state and this nation. So a very important aspect of this youth policy is the aspect of one program, which we're calling One Skill, One Talent. This is a very unique program to our state because we want to ensure that every youth of the state should have one skill and should be allowed to pursue one talent. And the government of Meghalaya will fund this skill and this talent program. So One Skill, One Talent will ensure that not only do they learn the skill, but it will allow the youth to engage with each other and channelize their energy in a much more constructive way. Please remember that the youth want to be engaged. The youth want to do constructive things. But if we don't provide the ecosystem for them, then we are failing in our responsibility. So therefore, this youth policy will try and address that particular issue.
Mr. Sangma, my next question to you is, Meghalaya is one of the pioneering states to use technology in various departments. You have recently launched a mobile app based on face recognition for the convenience of pensioners. How successful have you been in technology adoption and penetration to the last mile? What is the future of e-governance in your state? Over to you.
E-governance is, and the use of technology is inevitable. And every state government has to use it. The question only is to what extent the technology will be applicable to the states, to what extent the officials and the team of the people working there in the departments can actually deal and accept it, and how far is the reach to the public. So you need to first of all ascertain what is your absorption capacity of the technology that is there. So a technology that is being used in the United States may not be applicable for a state like Meghalaya. So first thing would be to understand what your capacity is to absorb what kind of technology. And realizing that we have a lot of technologies available with us, but we realize that we cannot do all of them in one go. So number one, what we have tried to do is ensure that whatever technologies are available to monitor programs. So the monitoring of programs we've realized is very crucial. So technology has helped us to monitor whether it's road construction, whether it's the health facilities, whether it's the pregnant mothers, whether it's the different schools, whether it's the Jeevan mission, PMGSY scheme. So we have used technology in a large way to monitor the ongoing programs of the government. Number two, we have also tried to use technology to facilitate simple services that we provide to the public. Now, what you mentioned about pensioners. Now, you see the pensioners are aged people. Now, they had to come every time to the department, to the office to show their face to prove that they're still alive. And therefore, it was very inconvenient for them. The simple face recognition technology is now allowing them just to blink once or twice, and it is showing that they are still there, and therefore the person doesn't have to travel the distance to get their pension anymore and to prove that they're still alive. So these are the kind of basic things that are there. But you're absolutely right. There is no other way but to use technology. Given Government of India, our Honorable Prime Minister has always advocated the use of technology, and we in Meghalaya feel the same. And we've been using the technology to ensure that we're able to improve the overall governance in our state.
Very well said. And let me also understand your point of view about the healthcare and education sector in the state of Meghalaya. Sir, your government has allotted rupees 980 crore to the state education sector and rupees 820 crore to the health sector as part of its annual budget 2021 and 2022. Has your government been able to ensure universal access to education and healthcare?
See, healthcare and education are one of the primary social sector services that any government should focus on. And Meghalaya and many other states in the country have been lagging behind. I should very, very frankly say that, lagging behind in the actual services being provided at the grassroots level. It's a massive challenge. It's not because of anybody's fault. It's just that we have a large rural population. We have large areas which are disconnected because of roads not being available out there, the health sectors not being available there. Health centers, educations, institutions being there but not being maintained, teachers not being very regular sometimes. So all these factors have been there. And in spite of the spending that the government of the center and the states have done, it has not reached up to the mark which one should have. And clearly shows in the kind of results that come out in the examinations and so on and so forth. So therefore, we realize that apart from the investments being made in the education and the health sector, use of technology, number one, is going to be very crucial. Number two is going to be investment in core infrastructures. Now, we realized that basic medication and basic testing that can be done in the rural areas also, simply because of availability of basic technology at the grassroots level. People had to travel hundreds of kilometers to come to the civil hospitals in the district headquarters. So what we have started is a movement of what we call a smart village movement. Now, the smart village movement is now tying up with different healthcare providers. And on a pilot basis, we have started about 7 to 10 locations where we are providing telemedicine, and we're providing different kind of services at the grassroots level so that people don't have to travel for basic healthcare facilities. So we are seeing the results of these investments. People are finding it very helpful, but obviously there's a long way to go. And as I said, it's important, not just the money you spend, but it's important to ensure that the entire system works. So you need technology, you need the manpower, you need other aspects to be working very well to ensure that all these services are provided at the grassroots level.
Let me bring in the current situation of COVID-19 in the picture. How has the Meghalaya government tackled the second wave of COVID-19 and contained the spread of coronavirus? What is your strategy to combat the third possible wave?
Yes, COVID-19, the second wave has hit our state also quite badly, like it has many other states in the country. And we have seen that after doing the genome sequencing, we realized that almost 95%, we can say almost 98% of the cases are of the Delta variant in our state. So therefore, the spread was double and triple the rate at which the first wave hit us. And also the number of people who lost their lives was also very large. So yes, it was a huge challenge. But I must congratulate and thank all the frontline workers, especially the health workers in the health department. They worked very hard, and the administration worked very hard to ensure that facilities like oxygen supply, facilities like the oxygen plants, the cryogenic plants for oxygen, the upgradation of the ICUs and the hospitals beds, we saw an increase of almost fourfold in the ICU beds in the state. Oxygen plants were unknown in the state at one point. We were just depending on cylinders. And today we have more than 2,600 liters per minute of installed capacity. And we are one of the few states that have got 2 cryogenic plants, which will ensure that in the long run, we don't have to rely on other suppliers for the oxygen supply to our patients. So we have seen that in the last 3 months, all these infrastructural investments and functioning have been made possible so that we are able to tackle this in a better way. At the same time, it's very important to also mention that our community and our people have been very, very supportive. So we have seen the community always come together, ensure that they support each other, ensure that we, if there are micro-containment zones to be managed, the locality comes forward and, volunteers to manage those things. These things help a lot because there's a limit to which the government can do things. But when society comes along and works together with the government, then we can face all different kind of challenges and situations. So that is a very important key aspect. And the third part, which you mentioned about the third wave, well, we're hopeful that we will not see an extreme case or scenario in it. But we are in the process of expanding more of the ICUs, especially for pediatric section. We are not stopping the overall investment in the health sector. We're continuing to invest in it because we don't want to be caught unaware. And therefore, we are doing our best, but we can't say how this virus will behave in the future. So we can only hope and pray and prepare that it does not hit us as badly as the second wave did.
Right, and you rightly said people's participation matter a lot. Mr. Sangma, recently there was an emotional moment for all of us when Neeraj Chopra won the gold for India. We are so proud of all these sportsmen who made the whole nation proud. Please share your plans to promote sports in your state.
Absolutely. This Olympics has been one of the most successful Olympics for the country. And we have got our first gold in athletics. And we have seen after so many years, the hockey team also managed to get a medal. And the women's hockey team also was almost there. So it was a great, Olympics for the country. And I would like to take this opportunity through you to congratulate all of the ones who got the medal and all the athletes who maybe did not win the medal, but have given their heart and soul for the last 4 years to really make the country proud. And I want to tell all of them that even though they did not get the medal, we are all proud of each and every athlete who had and sports person who had participated in this Olympics. Having said that, yes, you're right that this is not the end, or we are not satisfied with this at all. In fact, this should have happened a long time back. And now we need to see that we double, triple, these numbers and we reach the double digits as soon as possible. And in this, I strongly feel that the fact that we have such a young population, the fact that a lot of them are, into sports a lot, we can see in the coming years that if the right training, if the right guidance is given at the right time, number one, you see, because we always wake up to the needs of the youth and the sports too late. So a child who's or a youth who's like 17, 18, if you start training them then for a particular sport, then we are already late. So a scientific approach to the sporting sector is required. So in our youth policy, we have included that aspect that we need to see the talent of the youth, identify that at an early age and then put them in the right training aspect. So scientific approach is important. Number two, the facilities at the grassroots level need to be given, that too in the rural areas. And number three, the right support has to be given to the sports people, whether it is in terms of coaching, in terms of the materials, in terms of different infrastructure, and maybe even financially. So all these aspects are there as part of our youth policy. And we do expect that in the coming years, Meghalaya also will be able to contribute to the glory of the nation by ensuring that some of our sports people from our state are also there winning the Olympic medals for our country.
I must say, Mr. Sangma, your state have a very good framework of policies, and congratulations. You recently launched Meghalaya Public-Private Partnership Policy 2021. Mr. Sangma, how does this policy facilitate and encourage private investment in your state? And can you please highlight some of the major focus areas of the state to attract the private sector investment?
Yes, you see, the private public partnership is a very important aspect of any kind of development or investment in a state. Sadly, the state of Meghalaya was one of the few states in the country that did not have a PPP policy, and which meant that there was actually no framework to let the private sector, if they wanted to invest, there was no framework to actually allow them to invest in the state. So there was a complete void, I should say. And therefore, we were seeing very less investment being made in the state. And we also have different land issues out here, because the land is something that belongs to the people. So we have issues and policies of Land Transfer Act. So all these have to be overcome with a friendly policy that will allow the investor to feel comfortable and yet be able to understand the sentiments of the local people, bring them together to have a win-win situation. And that's really what this policy is trying to do, is trying to balance out between the needs and the overall desires of the business community and the investors, and at the same time balance out between the sentiments of the people and trying to converge all of that. So we have something called a community PPP policy also. So how can a private sector form a PPP with a community and work with them for the long-term overall growth and sustainability of their business? So this is what this policy covers in short. And the sectors, obviously, which we're looking at very strongly are tourism sector. Tourism is a huge potential in our state. So we feel that PPP policy and partnership in the tourism sector will be great. Number two, we also see a huge opportunity in the agriculture, food processing, and horticulture sector. So that is again a massive sector. We have a lot of products which we feel can be of great value to the rest of the world, and therefore the right investments, the right packaging, and the right market linkage will allow us to ensure that the farmers get the right pricing for their products in the long run, and the products from Meghalaya can be then shared and distributed throughout the world. So these are the few areas that are there. It's a large section. It will require a more detailed discussion, but in a nutshell, that's really what the policy is about.
Mr. Sangma, Meghalaya was carved out of Assam as an autonomous state in April 1970 and was declared a full-fledged state in January 1972. What will be the major attraction of your 50th anniversary of statehood? How are your preparations going on?
Yes, 50 years is a long time. And we will be celebrating that next year on the 21st of January. And obviously, as a state, we are very proud of it. And we thank all our former leaders and the fathers of the state who had sacrificed and contributed to making the state what it is today. But yes, a lot is there to be done. A lot more is desired. And therefore, going forward, we are looking at ensuring that we focus a lot on social sectors. Now, it's very sad to see that even after 50 years, our state had one of the highest MMRs, one of the highest IMRs, which is infant mortality and maternal mortality. And we have been working very hard as a state from the very beginning of this government to ensure that we are able to reduce that. And I'm happy to inform you that we have been able to reduce it to a large extent. But we still need to do more. We should be one of the top, states in the country today in terms of the least number of IMRs and MMRs. Basic things like these are factors or issues that concern us and bothers me a lot when I see that mothers have to lose lives just because we're not able to manage the overall health sector at the grassroots level in a much better manner. So now, after the last 2.5, 3 years working on these aspects, we've actually been able to really reduce. We have a special program that tracks every pregnant mother. We ensure that the high-risk mothers are always, contacted and helped and supported. And by doing this micromanagement of the pregnant mothers, we have been able to reduce the MMR to a large extent in the state. So obviously, these are important factors. But apart from that, we are really looking forward to also ensuring that our youth become very productive. We are looking forward in the next 10 years to be in the top 10 states in terms of our per capita GDP. We want to also be right there on top when it comes to the sustainable development goals. So these are basic targets that we have. Obviously, these are numbers, but when we work on the details on how to reach those numbers is really what matters. So we have got a very detailed plan on the per capita GDP. We've got a detailed plan on how, we'll have a district action plan, a state action plan on how we can achieve the such sustainable development goals. So all these factors will be there to ensure that we take our state forward. But the youth, the health sector, the education sector, the infrastructures that we need to create are going to be top in the priority of our state in the next coming years.
Mr. Sangma, we are almost at the end of the conversation. So my second last question to you, the Union Ministry of Tribal Affairs recently decided to look after 830 villages in Meghalaya for 5 years to shape the overall development and make them self-sufficient in several parameters of development. How are these plans shaping up in this regard?
Yes, this is in fact a very, very positive, I should say, a scheme and a program that the government of India, the Tribal Affairs Ministry has started. And I would like to thank the Tribal Affairs Minister, Shri Arjun Mundaji, and the Honorable Prime Minister for really giving this special focus to the tribal areas and the people. For Meghalaya state, yes, there are about 800 plus villages that have been identified for the next 5 years. And it's a kind of a gap funding and a gap programs that wherever the programs are required in a particular village to uplift the people in terms of infrastructure or livelihood or social sector. So these programs can be implemented in a very tailor-made program for every village. So that's the beauty of this particular scheme. And yes, we have to start it and see how it goes. One cannot really conclude before it starts how it'll conclude. But I'm sure that this, along with all the other efforts that are being made, whether it's through the MGNREGA, whether through other central schemes, whether it's through the social schemes and the agriculture schemes and development schemes that the state government is doing, this will be a big boost. And we can really then work, because the financial support will be there. We'll be able to work and, take these 800 plus villages to a new level. So it's a great initiative, but it really has to be planned out well. Every village will have its own requirement. Every village will need a tailor-made development program. So that is going to be the real challenge. So it's going to be important to go down to the grassroots, work with the local people, and ensure that the implementation is done in a good manner. And again, technology will play an important role in this entire aspect, whether we talk of space technology to really do satellite mapping of which villages require what kind of development aspects, or whether it's working with the VECs at the village level or with the social organizations at the village level. So all this coordination will be key to ensure that this program succeeds.
I think you yourself can guide government better because you yourself have been an entrepreneur and you started your business venture in the IT sector in late 90s. So my last question to you, Mr. Sangma, last but not the least, what are 3 major achievements of your government which you feel proud of? And going forward, what are your priorities for the current fiscal 2021 and 2022? Over to you.
Well, achievement is not a easy thing to talk about. Number one, I don't want to say that we've achieved anything as such, because it's not fair to really say, because a lot more needs to be done. But I can say that few things when I look back, I'm happy about, is that overall, when I started off, I had mentioned, to the press and to the public, that I strongly felt that the delivery mechanism to the grassroots level was missing. So we get the money from Government of India. We get the money from externally aided projects. We have our own states schemes, but somehow it doesn't trickle down to the grassroots level and does not have the kind of impact that it should have. I'm happy that in the last 3 years, we have been able to improve the delivery mechanism, be it whatever overall schemes you talk about. Today, MGNREGA, we are one of the highest in the country. We get about 1,600 crores a year. And on an average, every VEC member gets 17,000 rupees a year, which is, again, as I said, one of the highest. We are one of the top performers in MGNREGS, which was not the case many, many years back. So because of the delivery mechanism improving, Our budget for MG and RAGS has gone up to a large extent. There were schemes like old age pension, where the senior citizens had to wait 9 months, 10 months, or even a year to get the entire amount in one bulk. We ensured that the money reached in advance to the different blocks so that the money could be released along with the salaries of the government employees. So every month, the senior citizens started receiving their old age pension on time. So these are very simple things. We didn't do different things as we say always, like Chief Khera would say. We just did it differently. We ensured that delivery mechanism improved. But yes, when I look back, I see that many areas like schools. Now we have over 2,000 schools in the lower primary. You'll be surprised, Arpit, to know that some of the schools, the buildings were never repaired for the past 30 years. And they are in such dilapidated condition that you cannot even expect a student to get proper education there. So we started repairing and building new schools. And today we have crossed over 500 of them. And the next 1.5 years, this year again, another 200. And next year again, another 400 will be done. So we will see a large number of interventions in these areas. I'm very close with the social sector. The overall, if I were to go into spending, I can tell you that the overall government spending in the state government has gone up by almost 20% in the last 2 years compared to what we had taken up until today. Even with COVID, our expenditure has gone up by almost 20-25%, and we will see almost a 30% to 40% increase in this financial year. So these are the kind of few things. If I were to go into detail, it'll be too many. So I don't want to talk about it. I don't think I have the time. I don't think you'll have the time for it because there's so many aspects that are there. But as I said, this is in a nutshell the areas. But going forward, as I said, for me, social sectors are very important. For me, infrastructure is going to be very important. For me to ensure that export, I look at Act East policy very seriously. And I am very, very positive about Act South, which is Bangladesh for a state like Meghalaya. And I feel that that is the key future growth engine for my state. And if we can actually work together with the Bangladesh government in terms of our exports and looking at the global market through ports like Chittagong Port, I think really is the future for a state like Meghalaya and even for the region of the Northeast. The youth is very important for me. So there are many things. So I don't think I'll do justice to it by talking about it now, but I just thought I'll mention these 2-3 points to you.
Thank you, Mr. Conrad K. Sangma. You candidly answered all our questions. Thank you for talking to us. It was really a pleasure talking to you. We wish you all the best for your future endeavor, Mr. Conrad K. Sangma, Honorable Chief Minister of Meghalaya. Thank you so much.
Thank you, Arpit. Thank you so much.